That was the staff at the Monmouth Medical Center in Long Branch, New Jersey, clapping out one of their COVID-19 patients who headed home after 6 days in the hospital. Sara Shamah is a patient advocate and has been on that team for 6 years. When patients are hospitalized with coronavirus and separated from their loved ones, Sara helps the family stay connected. And Sara joins us from Monmouth Medical Center in Long Branch. Sara, so what does a patient advocate do? Take me through your role.
So before pre-COVID-19, basically I would go into patients' rooms if they had misunderstanding, not even misunderstandings, but let's say that they didn't understand what a doctor or a nurse was telling them about their condition, or if they had questions that they needed answered, or if they had something that they needed particularly for their stay in the hospital. We would go in as a patient advocate. I would go in, I would talk to them, find out what their answers are, give them to them. If they just needed a hand to hold, I was able to hold their hand, comfort them, be with them. Even the simple act of giving somebody a warm blanket and pillow makes the difference in the world to somebody who is sick and scared in a hospital.
How has your role changed since this pandemic?
Because everybody is possibly contagious, I'm not physically allowed to be in a room like I used to be. Now, and unfortunately, a lot of our patients are very, very sick. Some of them are on ventilators, and they don't have a voice for themselves. And I've been getting phone calls from family members who are not allowed in the hospital, obviously for safety reasons, for their own health, for the health of our staff, for the health of the patients that are here. They've been reaching out to patient advocates like myself and saying, what's going on? We haven't been able to get in touch, with a nurse or a doctor. Can you please help us? And, basically, I'm the person that's going up to the floors, and I'm actually going to the nurses and say, hey, listen, I know you're busy. I know you have a lot on your hands. Please, can you just give me something to give back to the family members so that I can comfort them in some level, in some way?
Sara, you are there witnessing some of the most intimate and private moments of a person's life. And even though you're there as a patient advocate, you've said that you feel a sense of guilt witnessing this. Why?
Okay, you're gonna make me cry. Okay, so basically, I've been called to go and FaceTime, and it's usually because they have to say goodbye, or they don't understand the criticalness of the patient, that their family member, and I'm holding an iPad up through a window, and I'm hearing the family crying and begging for their loved one, please wake up, please come back to us. I try to be quiet with my crying, because the guilt that I feel is that this belongs to the family. This is not my loved one. Thank God. This is their time, and their time to feel sorrow and pain. And why am I crying? And I have to literally talk to myself and say, hey, your heart is breaking because you feel their pain.
Oh, listen, the very title of what you do is patient advocate. You told me at the beginning of our conversation, even giving someone a blanket or a pillow makes the difference. And you have to know that what you do makes a difference. Holding that iPad up, being the messenger of love that people need right now is why you're so special, and it's why we wanted to reach out to you and give you a virtual hug, but give you the verbal thank you that you deserve. So we're grateful. Your tears are real, and we cry with you, but we celebrate the fact that people like you exist.